Good morning. This is Dr. Christina Hammer coming from Vibrancy VIP Med Clinic, here to talk to you about hormone optimization and how it can help the inner and outer wellness of your lives. So, why is hormone optimization important? Because it improves the quality of your life, such as giving you more energy, helping with fatigue, helping with sleep, with your mood, as well as weight gain. Those are just some of the key examples of how it can help optimize your life. Okay, so around the age of 30, it has been shown that people start losing their hormone optimization. It can be earlier as well as later, but we're finding that it's around the age of 30 years old. Why is it important to use something natural over something synthetic? So the important reason why I choose Biote pellets is because it doesn't go through the liver, so we're not messing with the coagulation factors, as well as we're not contributing to liver disease or heart disease. Another important thing is it's not a one box fits all. We kind of do specific dosing for each person based on your age, your weight, as well as the blood levels. So why is it important to choose pellets over other methods such as injectables, topicals, or even suppositories? Well, the reason being is that very little information is actually known of how much is actually absorbed into the skin when we use topicals or even creams or patches. The same thing goes for when we're talking about injectables. Each of those methods, even if it's natural or synthetic, has to go through the liver. So things that we worry about is high blood pressure, heart disease, as well as liver disease. So let's talk about some benefits of hormone optimization. Well, earlier we mentioned about fatigue, so it helps give us back that energy so that way we have the endurance as well as the strength when we're working out, and it actually shows it on our body with toning up our muscles as well as losing that belly fat that kind of accumulates with time as well as age. So the important thing with Biote pellets is the fact that it helps put on cartilage in between our joints from what we have lost in time. As we get older into our 30s, that's where we start feeling muscle aches as well as joint pain because of all the wear and tear that is on our bodies. When we put the pellets into our bodies, not only does it help with cartilage as well as the muscle aches and joint pain, and it puts about 8.3% of bone mass back onto our bodies each year that we do our pellets. That is crucial when it comes to osteopenia and osteoporosis of what we're seeing when we're losing our hormones. Another factor is sleep. A lot of people have difficulties falling asleep, staying asleep, as well as waking up refreshed. The most important thing is that we get our sleep back because it improves the quality of our lives. So each time we do our Biote pellets, each person gets an individualized consult one-on-one to talk about the issues as well as symptoms that they may be having, as well as kind of get to know what this patient is going through and how we can help optimize it. Because sometimes it's not just the hormones, but it could be vitamins, nutrients, diet, lifestyle, as well as exercise that we need to play into the role for optimizing someone's health and giving them a better quality of life. Cardiac disease is a leading cause of death in females in the United States. As we age in the perimenopausal phase, women have a 1 in 7 chance of a cardiac-related incident. That chance increases to 1 in 3 after menopause. These pellets help our heart health by giving it the hormones that it needs to actually give us a longer and better life. On top of that, it's very important to keep the heart healthy in relationship. Pellets help optimize our libido. Libido is very important into the intimacy triangle because it's not all about sexual intercourse, it's also about the closeness as well as the bonding that we have with our significant other. So a lot of women are very embarrassed to talk about what they're experiencing, even with their girlfriends. So when we have our one-to-one consults, we talk about everything that could be affecting them with their low hormones, males as well as females. Some of the things that I hear with women is chronic UTIs, vaginal dryness, itchiness, pain with intercourse. That's a no-go. It's important that we give back the natural lubrication that these hormones can replace. After each consult is completed, I do order extensive blood work just to make sure that there's no underlying etiology that could be compromising their health and not giving them the optimization with the hormone pellets. After we get the blood work and it's completed, I do have another one-on-one consult to go through that blood work to make sure We see what was ordered, why it was ordered, what does it mean, and what are we going to do? Because not all things are going to be fixed with pellets, but other nutritional aspects such as vitamins, as well as optimizing other levels in our body. So a lot of times people like to ask me, how long do these pellets last? Well, it's not a time-based methods such as other variants out there. It's based off your cardiac output. So I tell my patients it can range from anywhere from 3 months to 6 months based off our cardiac output. So I like to say people who are marathon runners or like to hit the gym maybe 6 or 7 days a week and do a lot of cardio, maybe 20 to 30 miles a day, they're gonna go through their pellets at a quicker rate than someone who doesn't work out as much. Working out is very vitally important, but I like to tell my patients each person is different and it's how our body metabolizes it through our cardiac output. So how do we calculate our Biote pellet dose? Well, the Biote company has a great way of calculating each person's dose because like I said, not one box fits all. We have to calculate each person's dose based off a method calculator where I put in each person's data such as their height, their weight, their age, their levels from the blood work that we just ordered. And that way it kicks out a level so that way we can help optimize each person's hormones. Not only do we optimize female hormones, but we love to optimize males as well because both females and males both have estrogen and testosterone. It's just the quantities that are different and we want a good balance in our body. After we have inserted the pellets, in a sterile procedure in the clinic, we recheck those levels again. For males, it's about 4 weeks. For females, it's about 6 weeks. Why do we do that? It's a very important, crucial step. The reason being is because we want to help optimize and balance. Even though we use a calculator to calculate the results, we still need to do follow-up labs. The importance of that is because, one, it's a calculator, and sometimes it can still have mistakes. So the importance of checking after the 4 to 6 week period for our males as well as our females is so that we can truly optimize their levels. I always tell people each person is individualized, and that's why we cannot just rely on a computer to give us those results. Not only do I look at the levels post pellets, but I also look at the symptoms because each patient will come to me experiencing different symptoms. So a lot of people like to say, well, where do these pellets go? I always say, that's a great question. Let's talk about that. So after we do the consult and we've followed up on those labs, it's time for the procedure. Patients say, okay, what do I expect? I like to tell my patients, we do a sterile procedure here in the clinic. It takes about 15 to 30 minutes because of prep as well as the procedure. The pellets are tiny. They're about the size of a rice grain. Female pellets are going to be a lot smaller than males because of the dose of testosterone that we give. Now, a lot of patients say, all right, so I'm up for this idea. What is next, Christina? I say, well, the next step is placing these pellets. I tell patients we cannot take it orally because if we take it orally, it's going to go through the liver. That's a no-no. We place it underneath the skin on the buttocks, not through the muscle, but in the subcutaneous tissue. So that way the pellets have a nice place so that way it can dissolve and give to our body a constant dose of hormones. So people like to say, well, Christina, is there any way that there's gonna be anything left over by the time these pellets kind of go through that 3 to 6 month time frame? I say no, it's all natural. Those products from the pellets come from soy as well as yam, nothing synthetic. Because when we have synthetic things that go into our body, things line up just like this. What we want is a perfect alignment, just like this. I tell people when we have perfect alignment, we're not gonna have side effects. And when we have balance, we're gonna have optimization of our health. So there's nothing left over at that 3 to 6 month time frame. Now, what we do like to do is change sides from the buttocks. So each time a patient sees me, I do like to make sure that we document. That way we know what dose was used, as well as if that dose was helping their optimization. And we see if there's any symptoms that they might be experiencing in between the time we've done those pellets. Each time we do those pellets, we do change buttocks. So I tell patients if we did the left side first, we're gonna go to the right and vice versa. A lot of people like to say, well, if I get these pellets, are there any limitations to what I can do? Yes, there are. So for females, I do have them have downtime for 3 days. For males, it's about 7. Why is that? It's because females just get a small dose of that testosterone and estrogen. Not everybody's gonna get estrogen, but everyone's gonna get testosterone. With males, they do not get estrogen, they only get the testosterone because some males like to aromatize that testosterone to estrogen, and that's no bueno. So a lot of my patients like to ask me, well, are there any do's or don'ts after the procedures? I tell people there just are a few don'ts that I don't want people to do, such as no lower body workouts such as squats, lunges, running, bicycling. They can still walk. I still want them to get their cardio as well as they can do the upper body. Things that I don't want either are baths, jacuzzis, pools. The reason being is I don't want infection, but you can still take a shower and you're gonna leave that Tegaderm on the affected area for 3 days for females, 7 days for males. If you're feeling any of those symptoms such as mood swings, sleep disturbances, fatigue, low energy, weight gain, especially around the midsection, mental fog, muscle aches, joint pain, come into Vibrancy VIP Med Clinic so I can have a consult with you today. Thanks for watching the video. This is Dr. Christina Hammer with Vibrancy VIP Med Clinic. Go ahead and click on the link below. Give us a call for your consult today. If you like this video, hit the like and subscribe button, and we'll see you next time.